Hello and welcome back to The Dentalist. Today we'll talk about the evolution of dental materials, comparing the tried and true with the cutting edge. Stick around as we explore the pros, cons, and the decision-making process that we as dentists undergo when choosing between established and new dental materials. Let's start with the basics. For years, materials like amalgam, gold, and glass ionomer cements have been the backbone of restorative dentistry. Known for their durability and ease of use, these materials have a long history of success. These materials have not only stood the test of time, but have also become synonymous with durability and reliability in dental care. But what underpins their long-standing trust within the dental community? Let's unpack the history, benefits, and limitations of these traditional choices to set the stage. History tells us that dental amalgam has been used for over 150 years, with its origins dating back to the early 19th century. Benefits of amalgam are known for its exceptional durability and strength, making it ideal for fillings in the back teeth, where chewing forces are the greatest. It is also relatively inexpensive compared to other materials and easy to manipulate during placement. Limitations of amalgam include its mercury content, which has sparked debates about potential health risks. Aesthetically, its silver appearance can be seen as less desirable than more natural-looking alternatives. Now, talking about gold, the gold standard. History informs us that gold has been used in dentistry for fillings, crowns, bridges for hundreds of years. Its use is deeply rooted in dental practice due to its unmatched workability and longevity, of course. Benefits of gold's biocompatibility ensures that it is well tolerated by the body with very low risk of allergic reactions. It wears down at a rate similar to natural tooth enamel, preventing excessive wear on opposing teeth. Gold also offers excellent durability. The most significant barrier to the use of gold in modern dentistry is cost, as it is one of the most expensive materials available. Like amalgam, gold does not match the color of teeth, which can be a cosmetic concern for patients, of course. Now, glass ionomer cement, which used to be the versatile choice. Introduced in the 1970s, glass ionomer cements represented a significant advancement in dental materials at that time, offering direct adhesion to tooth structure and the release of fluoride to help prevent decay. Benefits of these cements include that they bond chemically to dental hard tissues and release fluoride for an extended period, providing additional protection against tooth decay. They're also biocompatible and can be used in a variety of applications, including fillings and sealants. Glass ionomer cements are less durable than amalgam and gold, making them less suitable for high pressure areas. They also have inferior aesthetic qualities compared to composite resins, although their appearance is more natural than that of amalgam, of course. While traditional options continue to serve as reliable choices for many dental procedures, the advent of newer materials reflects ongoing efforts to improve patient outcomes, comfort, and aesthetic appeal. This historical perspective explores how innovations like composite resins and ceramics are addressing the limitations of traditional materials, offering enhanced properties and expanding the possibilities for dental restorations. Fast forward to the present, and the landscape is evolving. In this era, we have a wide range of options to choose between the traditional ones or bioactive materials, ceramics, and composite resins with enhanced properties. These new dental materials promise not just to restore, but to actively participate in the dental health of patients, promoting remineralization and offering superior aesthetics. But what's driving this innovation? And how do these materials stand up to the test of clinical application? There is a growing desire among patients for dental restorations that look and feel like natural teeth, right? This has pushed the development of materials that can closely mimic the appearance of tooth enamel in terms of color, translucency, and texture, as we've talked about this before. Now, talking about advancements, the field of biomaterials has seen significant advancements with new discoveries about biocompatible materials that can integrate with or even stimulate the natural tissue regeneration process. There is an increasing emphasis on preserving natural tooth structure and using materials that support the tooth's health, leading to less invasive procedures and materials that can bond to or support the natural tooth. With growing awareness about the environmental impact of dental materials and concerns over substances like mercury in amalgam fillings, there has been a push towards safer, more sustainable options. So, these are the factors that actually drive the innovations in dental materials. And I hope you would agree with how important these innovations in dental materials are. Several new materials have emerged, promising to revolutionize dental care. Modern composite resins offer superior aesthetics with a wide range of shades and translucencies available. They bond directly to the tooth, allowing for conservation of tooth structure. Advances in composite technology have also improved their durability and resistance to wear. Dental ceramics have evolved to offer excellent aesthetic properties and high strength, suitable for both interior and posterior restorations. Innovations like lithium disilicate and zirconia-based ceramics provide options for crowns and bridges that are both durable and visually appealing. Perhaps the most exciting area of innovation for me is the bioactive materials that are designed to interact positively with biological tissues. They can release minerals such as calcium and phosphate and many others, which are essential for tooth remineralization, promoting the repair of tooth structure and preventing further decay. Advanced new formulations of glass ionomer cements have improved their aesthetic properties, mechanical strength, and fluoride release, making them more versatile and effective in a broader range of applications. One of the critical factors in material selection is performance under pressure. Literally, the mouth is a challenging environment with factors like bite force, acidity, and wear and tear to consider. How do new materials measure up against gold standards like amalgam or glass ionomer cements in terms of longevity and durability? Clinical studies and real-world applications have shown that modern composite resins and ceramics can achieve aesthetic outcomes comparable to natural teeth, with satisfaction rates from patients being very high. Bioactive materials have also demonstrated their potential in promoting remineralization, although long-term studies are still needed to fully understand their impact. The latest generations of composite resins and ceramics have shown improvements in durability and longevity, with some studies indicating performance that rivals traditional materials in certain applications. However, the success of these materials can depend significantly on the skill of the dental practitioner and the specific clinical situation. While new materials may carry a higher initial cost than traditional materials, their potential for longer lifespan, reduced need for replacement, and preventative benefits could offer cost savings over time, I believe. For many patients, the look is just as important as function, right? Here, newer materials often have a clear advantage, offering natural looking results that traditional materials can't match. But it's not just about beauty, it's about biomimicry, replicating the natural looking properties of teeth. We'll explore how advancements in material science are blurring the lines between natural and artificial, bringing us closer to restorations that feel and look indistinguishable from the real thing. The advancements in material science contributing to this shift involve complex chemistry, nanotechnology, and a deep understanding of dental biology. Here are some of the key areas where innovation is making the difference. Modern composites are engineered at the molecular level to closely match the optical properties of tooth enamel and dentin. This includes varying degrees of translucency and fluorescence, ensuring that restorations not only match the color but also the way light interacts with natural teeth. High-tech ceramics now include materials like zirconia and lithium disilicate, which offer strength and durability on par with natural tooth enamel, while also achieving a similar look and feel. These materials are particularly useful for crowns and veneers, providing a metal-free option that stands up to the forces of biting and chewing. Bioactive materials represent a significant leap forward in biomimicry. These materials are capable of interacting with dental tissue, supporting the natural remineralization process, and even stimulating the growth of new tissue. They not only restore function and aesthetics, but also actively contribute to the tooth's health. Advanced GICs, glass ionomers, have been formulated to offer better aesthetics and physical properties while retaining their original benefits such as fluoride release and chemical bonding to the tooth structure. Their ability to support natural tooth health makes them an essential part of the biomimetic approach. Materials that mimic the strength and resilience of natural teeth can restore full functionality, allowing patients to eat, talk, and smile without any concern. Biomimetic materials are designed to be long-lasting and compatible with the body, reducing the environmental impact associated with dental restoration. As research continues, the future of biomimetic dental materials looks promising. With ongoing advancements, we can expect materials that not only perfectly mimic the appearance and function of natural teeth, but also harness the body's healing processes, leading to even more effective and holistic approaches to dental care. Adopting new materials isn't as straightforward as it may seem. Beyond the allure of better outcomes, dentists face real challenges, from the learning curve associated with the new techniques to the uncertainty of long-term outcomes. We'll discuss how professionals navigate these waters. While the prospect of utilizing the new dental materials comes with the promise of enhanced outcomes and patient satisfaction, the path to incorporating these innovations into everyday dental practice is fraught with challenges. One of the most immediate challenges is the steep learning curve associated with new materials. Each innovation comes with its own set of handling properties, application techniques, and clinical considerations. Many dentists tackle this challenge head on through continuing dental education courses. These programs are designed to update the practitioners on latest materials and methods, providing hands-on experience in a controlled setting. Incorporating new materials often require a period of adjustment in practice. Dentists may start by using new materials in less complex cases to build their confidence and skill level before applying them to more challenging scenarios. That's how we learn every new technique, right? Engaging with peers through professional networks or study groups can be invaluable. Sharing experiences and tips with colleagues who have already navigated these waters can shorten the learning curve for others. Dentists stay informed about the latest research and clinical studies that provide insight into the long-term reliability of new materials. Peer-reviewed journals and professional conferences are key sources of this information. Many manufacturers offer detailed data on the clinical testing and performance of their products. Dentists often rely on this information to gauge the long-term viability of new materials. When using newer materials, careful patient selection becomes crucial. Dentists may opt for patients who understand and are comfortable with the relatively unproven nature of some new materials. Ensuring informed consent is obtained, definitely. Building strong relationships with suppliers can help dentists gain access to the newer materials at competitive prices, as well as support and training on how to use them. Patients may have high expectations for the aesthetic and functional outcomes of newer dental materials, influenced by marketing and social media. It's essential for dentists to manage expectations through clear, honest communication about what new materials can achieve and any associated risks or uncertainties. Using before and after photos of cases completed with newer materials, models, or digital simulations can help patients visualize the potential outcomes. The integration of new dental materials into practice is a complex process that requires a careful balance of enthusiasm for innovation with a pragmatic approach to learning, cost management, and patient care. By embracing continuous education, leveraging professional networks, and staying informed about the latest research, dental professionals can successfully navigate these challenges. What do patients think? Safety, comfort, and the power of choice play a significant role in the decision-making process. With increasing access to information, patients are more informed and involved in their dental care decisions than ever before. Behind every material, old or new, is a body of research and clinical trials. But navigating this information can be as complex as the materials themselves. If you, as a dentist, are always willing to make the leap towards newer materials, what does the transition look like for you? Please let me know in the comments below. From additional training to investing in new technology, a forward-thinking dental professional always tries to stay at the cutting edge of dental care. And it's not just dentists. Dental schools and continuing education programs are also adapting, preparing the next generation of dentists for a new era of materials. As we've seen today, the choice between traditional and new dental materials is more than just a question of preference. It's a reflection of how the dental field continues to evolve driven by innovation, research, and patient needs. Whether you're a dental professional navigating these choices or a patient curious about your care, staying informed is the key. Thank you for joining. If you found this helpful, give us a thumbs up and don't forget to subscribe for more videos related to dentistry and technology. Have questions or want to share your experience with dental materials? Please drop a comment below and would love to hear from you. Until next time, keep smiling and keep questioning, because the best in dentistry is informed dentistry. Take care till we meet again.